Hello, I'm Jennifer Wenzel, Montgomery County Health Commissioner. Public health is working to eliminate racism as a factor in poor health outcomes. Learn how racism affects your health.
Most Americans want to live in a world that is fair and just. Unfortunately, in our society, many policies and practices give unfair advantages to some people over others based on their race. Race is a way our society groups together people with certain physical characteristics, like the color of their skin. Race is not about people's biology or genes.
We've all heard of racism, but we may not realize that racism is more than people treating other people unfairly because of their race, language, or culture. Racism includes the systems, policies, and practices that unequally hurt or disadvantage people who are not seen as white. Some people might think these things are in our past, but even today, there are still policies in place that harm people who are not regarded as white. And some policies have had lasting harmful effects on people depending on their race and ethnicity. For example, unfair housing policies have led to conditions today where people of color are more likely than people who are white to live in communities without access to healthy foods, public transportation, healthy homes, quality education, safe places for recreation and physical activity, and good medical care. Where we live, work, learn, and play impacts our health and well-being.
While a person's race does not increase their risk for poor health outcomes, race is a marker or a sign of other factors in our society that increase the risk for negative health outcomes. For example, research shows that people in some racial and ethnic minority groups in the U.S. have higher rates of diabetes, hypertension, obesity, asthma, and heart disease than white people, which is due in a large part to the systems, policies, and practices in our country that make it more difficult for many people of color to be as healthy as possible. We see racial and ethnic differences in health due to differences in how people are treated in society.
So what can we do to eliminate racial and ethnic differences in health?
Public health professionals and communities must continue to conduct and share research about how racism impacts health, develop effective interventions that counter racism, and develop and support policies across sectors like transportation, education, and housing that eliminate racism and its effects on health.
To build a better nation for everyone, we must commit to understanding and changing unfair and racist policies and practices that prevent us from achieving our best health as individuals, communities, and a nation.